Afternoon, North Dakota. Thanks for joining in. I want to start out with a personal shout out. We've had over 75 of these press briefings, and key to every one of them has been Mike Nowatzki. He's not here today because it's his birthday, but he's been working remotely. Just got off a video call with him. So happy birthday, Mike. Thanks for working on your birthday. Today we've got myself and our special guest today is First Lady Catherine Burgum, who'll be talking about Recovery Reinvented. We also, afterwards, for questions, both Superintendent Baszler and Head of Human Services Chris Jones will be here. For questions, let's jump right in. We know that new cases and positivity rates are still moving in the wrong direction in North Dakota, but as we have described before, we need to put this in context of where we are. Last spring, when our numbers were great, so was everybody else's in the upper Midwest, and we had perhaps the good fortune to think that this was never going to be destined for the Midwest or the Rockies, but now as some of the rest of the nation maybe gets some respite, there's a large swath of states through the upper Midwest into the Rocky region that are facing the brunt of the COVID storm right now. And of course, as we've said, other things are different because last spring we had schools were closed, universities were closed, and we were heading into warmer weather where we had more opportunity to be outside, and we were moving out of flu season this fall. Here we are in North Dakota with our economy open and our schools open, our universities open. Winter coming on, flu season coming on, and we're surrounded by other states that have record cases as well. Sadly, we know that this can be a deadly disease, particularly for those with age or underlying conditions. And there was just in our region, there was other states that set daily records for deaths on Wednesday: Iowa, Minnesota, and Montana, and Kansas, Wisconsin, to mention a few, and even Hawaii, which has been basically closed down to visitation, set a record for deaths on Wednesday. Wisconsin, Illinois, Kentucky, Colorado, and Ohio all reported daily increases in new infections, and 14 states in this region and around the country also had peak hospitalizations during the entire pandemic, including Alaska, which has also been largely isolated through this time, but Arkansas, Iowa, Kansas, Kentucky, Montana, Missouri, Nebraska, North Dakota, South Dakota, Oklahoma, Utah, West Virginia, and Wisconsin. So, however, through all this, we've been seeing that there is many positive things happening in our state. We're seeing local action supported by our state guidelines. And I think I want to, again, also focus a little bit on the White House report this week, because the White House puts out a report. They were clear in their report this week that there must be increased mitigation in North Dakota. We're seeing that at the community level, which is fantastic. They talked about how that partial or incomplete mitigation must be what's going on right now, because that would help explain the increased spread. And we know that mitigation works. There's been many, many debates about masks and mask usage and mask mandates or not mandates, but we know that mitigation works. And the most effective form of mitigation, of course, is social distancing. This is a disease virus that spreads from human to human. So if you're not around other humans, you're not going to get this disease. So that's the first thing. In North Dakota, as we joked about early on, we've got plenty of space for physical distancing. It's something that people say we've been doing since statehood, and so we've got that opportunity here in our state. When we're unable to physical distance, the White House guidelines went on to say, if you can't physical distance, mask wearing, hand hygiene, avoid crowds in public, and avoid hosting private gatherings as an alternative to avoiding crowds in public. Now, does that sound like something we've been talking about for 7 months? Because the North Dakota SMART guidelines are exactly that, which is physical distancing. If you can't physical distance, wear a mask, wash your hands often, and again, maintain distance from crowds or avoid crowds. So it's not a question of do we need a new approach, or do we need to have the White House put it in a memo versus what we've been saying here in North Dakota for 7 months? What we actually need is increased compliance or increased participation, increased motivation for participation in helping to slow the spread. So I want to announce really today to the whole state to put out a challenge, and I'll call it the Thanksgiving Challenge, because it would be really great to be sharing with all of you at Thanksgiving that our numbers are going down as we head into the holiday period, that we've got increasing amounts of hospital capacity, that our schools have remained open, that our businesses are open during that holiday season, that holiday gatherings can go ahead with families. And so if we want all of those things that we dearly love, we have an opportunity. Mitigation takes some time because the incubation period of this can be several weeks. So if we change behavior, get more people social distancing, more people being aware, more people practicing face coverings when they can't socially distance, even if we start all that today with 100% compliance, it would be a couple weeks before we would start to see, we might even see numbers go up before we saw them go down, but they would go down because places where you've had increased amount of mitigation, increased mitigation leads to lower case transmission, where all of the mitigation is about reducing the number of transmissible moments. And so we know that we have the ability to do that, so there is choices that we can all make here in terms of how we want to participate in that. And as I've said before, everybody needs to find their why on why they might want to participate, and we can stop arguing about masks or mask mandates, and all agree that our interaction with other humans and how we do that has the potential to increase transmission rates. We just know that. And so everybody has a chance, and when you're finding your why, you can look to find your why, maybe by finding what you love. If you love your community, that might be a reason. If you love your sports team that you're a member of, if you love your school and you want that to keep open, you don't want your classmates to miss any school, if you got a favorite restaurant that you like going to and you're worried about them and their future, that'd be another reason to, again, practice the SMART guidelines that the White House has been recommending, that North Dakota's been recommending, especially with the recognition that we're in the middle of a COVID storm. If you're in the middle of a winter storm, you don't go outside without a jacket. You don't, I know in our family growing up, you made sure you had a shovel in the car and a winter survival kit. When we're in the middle of a COVID storm, it'd be a good time to understand the context of the region we're in, and that now more than any time since this began is a time for us to start thinking about how we can take actions. Because there's lots of debates about how do you have increased amounts of compliance, and some would argue for more government mandates. Others would argue against those, but we do know that this virus, because if it transmits in close contact under 6 feet, then this really comes down to a family by family, business by business, school by school, community by community approach in terms of the best way to increase the amount of people that are participating in slowing the spread. And that requires leadership at all levels, and the leadership can come from people at any ages, whether you're a student or whether you're a leader in your family, your community, your club, your organization, your team. You can be the one that helps set the pace, that helps slow the spread and keep everybody safe. And particularly if we're looking for things we love, I think we all know that we have a culture where we want to respect and do respect our elders, those that have helped build our state and help contribute to our state. And those elders in our state are somebody we also, if we care about them, and whether they're living at home or living in a congregate living setting, again, find your why, find who you love, and find a reason to be part of the solution. But when we talk about leadership everywhere, we've had a number of people that have really stepped up this week, and our state is a very diverse land and diverse people. We've got areas that are densely populated. We've got areas that are vast farm fields and expansive ranch land where it can be miles and miles between neighbors. And so we know that when we're dealing with this pandemic, that it really comes down to each unique community, each county, each city has got to have the ability to make local decisions based on the risk within their community. And if the number one best way to stop the spread is individual responsibility, the next backstop behind that is communities getting together and making decisions about what they want to do to stop the spread in their communities. The past several weeks, we've begun weekly meetings, and we'll continue these throughout the pandemic. We meet with the mayors and county commissioners that represent close to 80% of the state's population, which means the counties from the large metro areas. We hear from them what's working, what's not working, what additional support they might need from the state or federals, and then we go to work making sure that they've got the resources that they need. And many of them have stepped up with their either by executive action or through their city commissions this week to take action. And we will highlight a few of those. They're working closely with their local task forces, with their coalitions, and with their local public health. Nearly a month ago, Mayor Klug in Williston took very strong action. He brought back together a COVID-19 coalition, limited permits, which again are issued at the city level for large events within the community. Mayor Decker in Dickinson took similar action by limiting large event permits in the community. It's been almost 2 months ago when we'd given a shout out to Mayor Buczynski in Grand Forks, who took the action of limiting the hours on bars closures to 11 o'clock and to help reduce the dense congregation of unmasked crowds at late night. Mayor Johnson from Devil's Lake is working with Lake Region Community College to bring together a community meeting today for ideas about how to brainstorm on slowing the spread. And I know that he's been reaching out to individual businesses in their community that have large amounts of customers to talk to them about measures that they can do at a even a store-by-store basis to help slow the spread in their community. And over the past week, we've seen action by Mayor Mahoney in Fargo, Mayor Sipma and the City Commission of Minot, Mayor Dardis and the City Commission of West Fargo, and Mayor Carlsruhe in Valley City, all taking actions to address increased mask usage in their communities. We've also seen chamber organizations step up from across the state and taking leadership with their membership to urge increased mitigation within businesses to help us keep those businesses open. We know that others are considering action and taking action, and we as a state stand by to support all these communities and their leaders in the tools that they need to help slow this. Because again, if there's something else that you love, and you love the health workers in your community, whether they're in long-term care or whether they're in the hospitals in your community, it's another reason we can continue to help them out by making sure we reduce community spread, because that takes a load off of those people who work in healthcare. Again, we know there's a lag time before the impact of those changes, so we want to see positive impacts. We expect that we'll see those several weeks out from now. But in the meantime, there's one other piece of advice we've been giving to people all along, and that's if you're not feeling well, please stay home if you're sick. Because while you may think you just have a cold, it could be COVID. You may think you just have the flu, it could be COVID. And you're interacting with other people when you're symptomatic could lead to others getting sick, which lead to others getting sick, which leads to dozens, if not hundreds, of new cases down the tree of infection, if you will, and that puts pressure on our hospital situation. So one of the simplest and kindest things we can do for each other right now is to make sure that we're being, again, as we said, North Dakota smart. This is not the time to be North Dakota tough and go to work when you're not feeling well. We're certainly grateful to all the schools, the faith-based leaders, the businesses, and the individuals who continue to make smart choices to reduce transmissible moments in their organizations and find alternatives for how to continue to work, keep their missions alive and going. And again, we know that all of these mitigation actions have real consequences. And so that's why, again, we're not asking businesses or others to make changes to their business model without support, because while this may be unprecedented in terms of us asking the business community and others to make changes. It's also unprecedented the amount of support that we're giving to those organizations, and we'll talk about that later on in this conference. But right now, let's jump into some numbers. This past 7 days, we had 5,614 new cases and over 4,200 people that were recovered, and of course, sadly, 52 deaths in the last week. And that brings us to a slightly higher new record of 63 active cases, up 13 from yesterday. The 11.3% rate for 7 days in North Dakota is a new high for North Dakota. There are many states that have lived in double digits level for months during this pandemic. These are our first days being in double digits. It's territory that we had hoped to avoid. As you saw from the slide earlier, we're doing substantially better than most of our neighbors, where we have other neighbors in this area that have, at the state level, that have 30+% positivity rates. So from a positivity rate standpoint, we feel in terms of the storm, we're weathering it better than others. We are doing far more testing than other states are. That is a positive thing, because that's helping us identify particularly asymptomatic cases, which then, when they isolate, can help slow the spread. This week does mark a huge milestone for testing for North Dakota. We are again leading the nation in this regard, and we have now completed more than one test for the equivalent of every North Dakota resident. So that's 799,000. Just about by tomorrow, it'll cross 800,000 tests in a state with 760,000 citizens, and that includes testing 279,000 plus unique North Dakotans, and others have been, including those people, have been tested more than once. Our testing in long-term care, not just in skilled nursing, but in basic care and in assisted living, both residents and care workers, again, viewed as a best practice. Many in the nation have not been able to catch up with that. And so, again, credit goes out to all the people that were involved in building up our in-state testing capacity. Yesterday, we did distribute, we've got some new testing tools coming on the way. For the first time, we're testing kits, rapid tests that only take saliva as a form of a test, and those are going to Fargo, Grand Forks, Minot, Bismarck, Dickinson, and Williston Public Health to be used as part of their testing capability. You might also recall that last spring, when Minnesota was getting hit hard, that we were able to conduct testing in our neighboring Clay County in Minnesota, part of the Fargo-Moorhead, West Fargo metro area. We were grateful to receive word this week from Minnesota Governor Tim Walz that they're making saliva testing in Clay County as they move to do that, but they're going to allow that to be open to residents in Cass County. And again, they expressed their gratitude for North Dakota conducting significant testing for Minnesota's last spring and summer. They're opening this Moorhead testing site to North Dakotans through December 30th or until they reach the number of tests that North Dakota provided to Minnesota. So like a good neighbor, Minnesota is going to be helping to test North Dakotans till we sort of match equivalency. We really appreciate that, because of course it is one community with I think 70,000 or more bridge crossings going back and forth between those two communities every day. They really are one community. We've got long-term care facilities that are operated by the same operator on both sides of the river. We have people that work on both, that live in one community and work in the other. And so the integration there, much like we have here in Bismarck-Mandan, but dealing with the complexity of two states, it's great to have that collaboration with Minnesota. The Binex Now tests, which we're receiving from the federal government, we're getting ready to deploy those soon, and those will be deployed. We're doing some validation testing on those right now, and then working on the IT systems to make sure we can get those rapid 15-minute tests into our systems, but we intend to start rolling those out in long-term care to help with residents, with workers, and potentially to help facilitate visitation. Our 14-day positive rolling average, this is slightly lower than our 7-day because we've got rising numbers. The 14-day always lags whether you're going up or down to a 7-day. But again, this is new territory, rising above 10% for the first time since we've been in the pandemic. I want to spend a minute talking about underlying health conditions. When we've been reporting those that have passed away with COVID, we've been always saying that the majority of them have underlying health conditions. Feedback that we've received from local public health and from the medical community, perhaps because we included those words, those are the words that come off of the death certificates, and so we are. Perhaps people think that by saying that somehow we're trying to downplay the seriousness of this disease. There's certainly more known about this disease now than there was at the time, and there's more known about the tie between underlying conditions and who is at most risk. One thing for sure, we know from the death statistics that this continues to be particularly challenging for people with advanced age, and as it is here in North Dakota, as it is around the country, the majority of those people who have passed either with or from COVID in North Dakota have been over the age of 70. But again, when we take a look at populations, one of the good things about North Dakota is people live long lives here. We have over 15% of the state population, or almost 115,000 individuals that are over age 65. So that's a group that's at risk. But when we've got this broader list of things that could lead to be considering a health condition which gives you a more risk of either serious illness or death from COVID. It includes things like cancer, like heart disease, like obesity, like chronic kidney disease, diabetes, asthma, and certainly smoking is also something that's been added to the list. So then we say, well, then how many North Dakotans have one or more of these underlying health conditions? Well, the sad news on that is that it's about 66% of the state of North Dakota has at least one of these conditions, and there are others included being like immunocompromised or people that might have recovered from cancer. So we don't want to give anyone a false sense of security surrounding their risk. So beginning tomorrow, when we're announcing the death certificates, we're removing the underlying health conditions from the news release. But if you want more detailed information on deaths, visit the dashboard at health.nd.gov coronavirus. And again, I know that as we tend to, during this, try to look at state-by-state comparisons. We're doing that here today on positivity rates. But when it comes to the death certificates, there's another level of challenge because we do know that states are reporting deaths differently. And so I'm sure this will be debated long after the pandemic is gone, but state-by-state comparisons can be challenging based on differences that the states are using in their coroner's office and others for how they're reporting coronavirus either with or from COVID. When we go to active cases across the state, I mean, again, this is the thing where we talk about our numbers headed in the wrong direction. We now have, again, we're in a position where every single county in North Dakota has at least one active case. The highest totals of active cases remain centered in some of our most populous region. That makes sense. With Cass at 1347 and Burley Morton being very similar combined, almost identical in that 1353 range. Grand Forks 672, Ward 623, Morton 341. I was including that in the Burley ones earlier. Williams 200 and Stark 196. The good news on this chart, the darker it is, then that's the more cases that you have. But if we flip to the active case rates, which is again dividing cases by population. We know that several weeks ago, Williams and Stark were among our highest in terms of cases per 1,000 residents. They've come down off of that. Some of our smaller counties that have had outbreaks have popped up on these lists, and we want to be very cautious not to make the same mistake the national media regularly does. So we're not going to, call out and write a statewide story about a very small county with a very low population that has a few number of cases, but on a per capita, they may be on the top of this list. But we would say again that there has been some positive movement in some of the western counties, and I'd say in the eastern part of the state in Burley-Morton, we continue to still go the wrong direction. With that, relative to the county levels, which we went into effect last Friday, we are not changing any of those today. We know it takes time for businesses to adopt. It takes time for people to sort through this. We'll continue to monitor risk levels, and we will be potentially making some additional changes next Thursday at our press briefing. When we take a look at this slide, one addition that we do have added on here is the 5 tribal nations with which we share borders. We continue to work closely with our tribes and they're doing work. Some of them have put in mask mandates and have had really strong masking throughout this, and we are going to continue to work with them, whether it's on testing or hospital capacity, to make sure that we continue to partner with them and whatever challenges they're seeing and whatever resources they may or may not have through the federal Indian health system. We do have on that chart that was up, we still have 4 counties that remain at the new normal or the blue level, 17 at the low risk or green, 15 at moderate risk, and 16 counties in high. And so again, if you're in a moderate or high risk county, which represents the majority of the population of our state, again, good time to pay attention. The active support of all of our local leaders and North Dakotans is one of the best tools we have to slow and stop the spread. Otherwise, we'll continue heading in a negative direction. And your actions as individuals and as communities can help drive a positive trend. And hopefully in the future, if we all are in this together, we'll continue to be moving in the right direction. So as I close out that section, I would put out again this challenge. Since we are 4 weeks away from Thanksgiving, I'll call this the Thanksgiving Challenge, but I would challenge every county and every community that's on that chart right now to have better numbers at Thanksgiving than you do today. That's the challenge, and we'll mark what your starting point is now, and we'll see who's going to be on the leaderboard in terms of taking that down to being having the most positive improvements between now and Thanksgiving. I want to also talk about contact tracing. We know that from the beginning of this, the testing and contact tracing work absolutely together. Both of them are invaluable tools, and they help guide the response of our resources. In addition to building some of the most robust testing, because we were testing at levels anywhere from 2 to, in some cases, 9 times more per capita than other states. Commensurately, the fact that we were able to keep up with contact tracing meant that we had, if we were keeping up with contact tracing, which we were till last weekend, that meant that our contact tracers were also doing more contact tracing per capita than almost any other state. We'd gone from less than 10 to over 450 trained contact tracers, and I want to thank them because that's their hard work, their dedication, and whether those were members of the North Dakota Department of Health, Department of Emergency Services, North Dakota IT Department, North Dakota National Guard, lots of people helped build that capacity. When we had the big increases last week in certain parts of the state, we did get overwhelmed. So we had a blip where we had a backlog that is extended resulted in extended notification times for positive results, thanks to decisive action and quick action this week by a number of people. The North Dakota Department of Health, along with the North Dakota National Guard, has successfully resolved the backlog of notifications. We had got over 50 additional North Dakota National Guard soldiers added to that effort, and more than 800 North Dakotans were notified, and we dug through the backlog in a day and a half. And as the third thing that I want to say is that we also also know that, hey, we're doing stuff which has largely been a manual process over the years, that we continue to add more automation. We've done this throughout with the contact tracing, but we've added a new capability. It was launched this morning for the first time, and 250 people were notified this morning that they were a positive case, delivering automated notifications. People can choose to be notified either by text or by email. When you receive those, you'll know it's from the Department of Health. You'll be asked to submit some personal information that confirms it's you, and then you'll get your results. And then I would also, again, say that for contact tracing for healthcare settings, K-12 schools, university systems are going to continue as usual, which is the teams that we have in place will continue working, doing in-person contact tracing, again, for healthcare workers. K-12 schools, university systems, and healthcare settings includes long-term care. So we'll continue with our resource against that. If you're an individual, you sign up for this, you could be notified automatically, get the results faster. That's going to help you make choices. There are new videos that are out on the North Dakota Department of Health website, and I think that some people were reacting that we were somehow asking people to do their own contact tracing. I was kind of shocked when I saw a reaction to that, because I would hope that throughout this pandemic, or even if it wasn't a pandemic, if you had the flu or some infectious disease and you found out you were positive, I would hope that you would be contacting the people you'd been around to say, hello, coworkers, I've got XYZ and I've been contagious. I thought I would let you know. So this is, again, part of that, the traditional North Dakota spirit of caring about our neighbors. And so now we've created tools. There's some short videos out there that help you understand what to do, and you can forward those videos to others and let them know that you yourself may be positive. But I would, again, hopefully we're providing a tool to support something that's been going on all along. We also, prior to this, did have a system that delivered automated notifications to individuals with negative test results, and that system will continue to work and has been working well. And of course, that's the majority, even right now. When at a 11% rate, that means that 89% of the people we have to notify are negative. And so that automated system working well. Now we've brought that over and are going to roll that out for positives. But again, grateful to the work of the contact tracers and everybody who worked to resolve that backlog, and everybody in IT that worked to bring in these new systems. Related to close contacts is the new guidelines we offered several weeks ago regarding the close contact and whether close contacts had to quarantine or not. We do have some information coming out of the schools. We know that masks work. We know that wearing them can help keep others safe. And in school settings, we had identified there were 300 individuals that were identified as a close contact to a positive. In 226 of these cases, so way more than 2/3 of that, 226, both the person who tested positive and the close contact were wearing masks. So this has allowed healthy young people who have very little risk of hospitalization. They're very likely not going to take any hospital capacity, almost negligible risk of death. Those healthy young individuals, if they're both wearing masks, then do not have to quarantine. They can continue to wear their mask properly and attend their sports and school, etc. This is helping keep our schools open and our students in school. It helps them with all their social and emotional learning. And again, this was an innovative new approach to create an incentive for mask wearing. And again, the 74 individuals that were required to quarantine, a good reminder for others that if you were both wearing your masks, then you wouldn't have to be quarantining. So again, particularly at the school level, there's a strong incentive now for everyone to do their part and wear masks when you're not able to socially distance. Next topic is new school dashboard. We have, of course, had one guideline through all of this, whether it's any agency in the state government, and even before the pandemic, we were committed in our administration to transparency. There's a number of things that have gone on that have helped us increase transparency, whether that's from OMB or whether it's through the Department of Health, but continually updating the information that we're sharing. North Dakota is going to be adding a new dashboard, the K-12 COVID dashboard. This is another layer of transparency that constituents, whether they're parents or teachers or school boards, can help us navigate the complexity of trying to get 120,000 students and their different learning environments in North Dakota all back to a in-school environment safely. This dashboard will provide a glimpse into our K-12 age population and how the virus is impacting student, staff, and communities. It'll do this in a way that protects individual health information, and we're launching this dashboard with school-affiliated tested data from static sites around the state as we work to prepare the remaining data collected as we work our way through this. We're going to continue to emphasize today. There was some confusion last week, so we'll say it again today. School instructional models, and the school instructional models might include, are you face-to-face, are you hybrid, are you distance? School instructional models are separate from any Smart Restart County colors. School districts, their school boards, their superintendents can make those decisions, and ultimately a parent can make the decision about where and how their student is going to be is going to receive their education. But again, those are unhinged from the Smart Restart. We want our kids in school. The data from around the country indicates that they can be there safely, and so again, this new dashboard will help everybody have information. So I'm grateful again to the NDIT department, the Department of Public Instruction, and especially to Superintendent Baszler for her leadership. And that website is going to be available at the health.nd.gov under the schools link. And so you take a look there. And as I said earlier, the Superintendent Baszler will be here for any questions related to K-12. Next topic has to do with the relief side that we're doing for individuals and businesses and support of healthcare through the coronavirus relief funds. As we've talked about throughout this, we've had, I'd say again, unparalleled or without parallel in the history of the state, collaboration between the executive branch, the agencies, and the legislature and legislative leadership during a time when the legislature is not in session. Whether it's calls and meetings that are happening every day, or the work that's occurred through the Emergency Commission in the budget section, there's been great work to act with both care and expediency to allocate North Dakota's $1.25 billion share of the CARES Act coronavirus relief funds. In an effort to get this deployed early, that was part of the strategy, because having money literally in the bank or in the Bank of North Dakota that wasn't in the hands of citizens or businesses or healthcare organizations or our schools was not helping anyone. So we had a strategy early on to try to make thoughtful, careful decisions about how we could get the dollars out. And of course, following the federal guidelines, this is money that could not be in any existing budget between beginning of March and December 30th. So it could not be part of any state budget prior to that. It had to be COVID related, and there's a number of other elements that were included in there, but this provided some guardrails, which we have followed closely throughout this. But we have had some turn back. We got that money out early, which was great, but some of it we've been able to be more efficient, and so when we have money that's come back today, the Emergency Commission had an opportunity to consider $220 million that was turned back. Some of that was because we learned there was a large allocation that was made for emergency loan programs at the Bank of North Dakota. Turns out during this time frame there was not an appetite for businesses to add more debt to their balance sheets. One of the good news things is we also had a turn back of a significant turn back from our unemployment insurance fund, and the reason for that was because we've been able to keep our economy open. We've had a record number of people come off the unemployment rolls, and it was announced yesterday that we as a state have the 4th lowest unemployment in the nation at 3.8%, and this is a credit to the business community and to the state working together to keep our economy open, because this is a 3.8, and we're still in the middle of a significant downturn in ag and in energy, and so again, this is really, really remarkable. So great work team on that. There was changes that were made in the rules, FEMA reimbursement to the Department of Health, and also to our Adjutant General, General Dorman, the National Guard, and Department of Emergency Services. With those changes in reimbursement, some of the dollars we had allocated for coronavirus relief funds can be accessed through FEMA dollars, so those were able to be turned back. And then we also had, through Commerce, had put together a program for energy resiliency grants, but we know that those, under the current guidelines, were not going to be fully utilized before the end of the year. And so those were some of the bigger areas of potential turnback. But what we have done, the highlights of the repurposing this is that with the action today by the Emergency Commission consists of the majority leaders and the two chairmen of the House and Senate Appropriations, along with the Secretary of State and myself. That group of 6 advanced these recommendations, which will be reviewed next week by the 24-member legislative budget section. But as of today, approvals that came out, we're going forward is 33.8 million going to K-12 on top of the roughly 30 million that was allocated before, so that brings a total of almost $64 million going on top of K-12, and that's on top of already North Dakota, one of the highest in the nation, with $10,000 of state aid per student. Another $64 million to help the schools with COVID related. This round of dollars that are going out today will allow more flexibility for schools, whether that's on tech support, mental and behavioral health support for students and staff, personnel-related costs, including substitute teachers, upgrades to ventilation systems and other physical plant or building improvements, and additional training for instructors and staff on the new teaching and learning environment. We also today had $10 million going to the 6 large referral hospitals, 2 in Bismarck, 2 in Fargo, 1 in Grand Forks and Minot. These hospitals have played, will continue to play a critical role in expanding hospital capacity if needed in the coming months ahead when we've got flu season, and we typically always have higher demand for hospital care in the wintertime in North Dakota, but when we have the seasonal demand plus COVID, that we feel that these are the organizations that need that. Particularly this grant is going to allow them to apply these grants towards incentives, whether it's paying bonuses for overtime, whether it's incentive packages for people working additional shifts. But all of these things are more cost effective than hiring more out-of-state contract nurses. We know that has to happen, but as we compete with other states for contract nurses, in some cases in the region, coming off of our weekly call with the hospital leaders from across the state, that in some places are charging as much as $150 an hour for a contract nurse. That money doesn't go to the contract nurse, it goes to a company. The nurse might get paid a fraction of that, but we want to, for that sort of labor arbitrage that can happen during a critical time like this, we want to provide the resources so that our large referral hospitals can help put money in the pockets of North Dakota healthcare workers that are working exceptionally hard, and help retain them, or to get people to come off the sidelines who may still have a license but haven't been actively on the front lines. This may help them with that. So again, I want to say thanks to the hospital leaders that we continue to work with, who are all committed to a planning process that's going to allow us to make sure that we're making the full and best use of the North Dakota's capacity. $29 million is going towards additional grants to support our hospitality hospitality industry, and again we're repurposing $25 million of the existing economic resiliency grant. So this is going to be a $54 million grant program. We know that those in the hospitality industry have been those that have been some have been the most hard hit, as travel has been reduced, and as guidelines sometimes include for more social distancing within hospitality organizations. If we're asking them to do their part to help slow the spread, we also want to stand up and give them support to help them do that. And these grants will provide up to $25,000 per location. Other things that quickly going through this thing on the money that was approved today, the Emergency Commission previously supported cities and counties in August, providing $59 million of CRF funds to reimburse them for law enforcement costs for the March through the earlier part of the summer, and we're now extending that for 5 more months. It's about $12 million a month. That will bring the grand total for the political subs to about $122 million to help cover the costs of law enforcement payroll costs. Those public safety payroll costs, they're considered allowable expense, but so they are allowable, so the payment goes out. They can easy for us to calculate what those dollars are. If a county or a local community had already covered that payroll cost, then this dollar grant, which is sent to cover payroll costs, they can use those dollars for others, whether it's first responders, for fire, for other needs that they may have within the city. So these are dollars that will be transferable within those communities once they receive them. We've also repurposed nearly $16 million to our Department of Human Services for a number of great things. We have continuation of the very successful Child Care Emergency Operations Grant, continuing that through December. That's $8 million. Long-term care and skilled nursing facility, environmental improvement that includes air purification and HVAC systems, over $3 million. Community-based behavioral health services, critically important right now, $1.7 million. The emergency rent bridge program, which thankfully there has not been much demand for, but we are continuing to support that for people that may be falling out of the bottom of the keeping people housed, as opposed to the more expensive approach for them to become homeless, to help them get through this time, $400,000. And then the Great Plains Food Bank and Senior Nutrition Services, $420,000. So again, those are all fantastic. And one of the other ones which was approved today for the energy industry. The energy industry is a critical part. It's about 9% of the GDP in North Dakota, but it represents over 53% of the North Dakota state tax revenue. Let me say that again, 9% of GDP, 53% of state tax revenue. It's critical that we support the workers in this industry, particularly those in North Dakota who've been put out of work, and we've found smart ways to do that and protect the environment. There was about $40 million that was spent earlier to help reclaim abandoned wells and plug those. That helped us keep employment for crews in North Dakota, but it also helped us solve an environmental issue. We were one of the first to launch that. That was copied by other states. And again, here we're repurposing some of those dollars that could not be spent because of the winter weather coming and the need to get this money expended by December 30th. We're repurposing $16 million to provide an incentive for to buy water acquisition. Water is something that is needed for both producing and also disposal after a well is fracked. And this will incentivize the completion of 80 wells, which will preserve 500 to 1,000 jobs in the oil fields. And each of these wells, when produced, will produce millions of dollars of tax revenue to the state. It takes about $150,000 of sales tax for all the other things they have to buy to complete a well. And so I have no doubt that this will be the highest return on investment for taxpayers of any CARES Act dollars we've used. And with 80 additional wells running, that'll help maintain oil production at the levels it is through the next summer, which again will help stabilize the entire budgets and the revenue, with 53% of state tax revenue coming from that sector. Then there isn't a single budget, whether it's K-12 or healthcare or infrastructure, public safety, the universities. Every single budget is touched by the energy sector. So again, finding ways to preserve employment for North Dakotans, buying North Dakota products to help keep that industry going. With that, in summary, I've got a slide here of the $1.25 billion, and I think again North Dakotans can all feel inspired by this chart, because when we take a look at the left side of this, which is the top left corner, economic support for businesses, lower left, economic support for individuals. These are represent well over half of the pie chart here. So you're talking about close to $700 million that's gone to help support those individuals who've been asked to make changes or sacrifices, who've been affected by the downturn in the economy because of this pandemic. And then on the right-hand side of that slide, we've been able to, for only 16% of this has gone towards the continuation of government services. And then the upper right-hand corner, public health and safety, that includes everything with the Department of Health and Human Services and everything we're doing on that right-hand side of the page to support local political subdivisions. So fantastic balance. And again, I know that other states that early on got caught up in the pandemic at a level like we saw in states in the Northeast where 1,000 people were dying a day in some of the Northeast states, that most of their dollars went towards fighting the pandemic, and we've been able to have more than half go towards supporting individuals and businesses. One of the reasons, when you look at that chart, it's one of the reasons why our unemployment is at 3.8%. So with that, again, I'd conclude on the coronavirus relief funds by, again, sharing my gratitude with the legislative leaders and all those that serve on the Emergency Commission and Budget section, and many more that have been in discussions on how to appropriately invest these funds for North Dakota to help us support the mission we've had all along, which is saving lives and saving the livelihoods. Next up, we got a very special speaker here today, and I'm grateful for all kinds of people in North Dakota, but probably number one on my list, it has to be the First Lady, Catherine Helgus. Her courageous decision over 3.5 years ago to share her recovery has changed the lives of so many people in our state. And she's gone from sort of having her recovery be a secret that was held in the closet, trapped by shame and stigma, to something where she's helped to release that shame and stigma for tens of thousands of people. She's been recognized nationally for her work. She's been invited to the White House on 5 different occasions, including recently this fall, where she spoke alongside of First Lady of our nation, Melania Trump, Surgeon General Jerome Adams, and the drug czar, Jim Carroll, who all, she's one of a few number of speakers at a White House event, sharing their stories about what this administration has done and what North Dakota is doing, particularly in that case, talking about creating recovery-friendly work environments. So we've got her 4th annual Recovery Reinvented event is coming up next week, and here to share more about that is the amazing First Lady of North Dakota, Catherine Helgus Burgum. Since we're a close contact, I'm going to stay here.
I'm going to put my mask here. Stick in my pocket. Okay. Well, good afternoon, and thank you so much, Governor, for inviting me here today to share with you about Recovery Reinvented, which is going to happen next Wednesday, October 28th. And thank you also for your commitment to making behavioral health a priority during this pandemic. The shame and stigma of the disease of addiction causes people to isolate and not reach out for help. I know this firsthand because I struggled for many years with my addiction. I didn't reach out for help because of the stigma. But I'm grateful to finally have had the courage to talk about my struggles with a team leader at work. And she encouraged and supported me to go to treatment. This support played a significant role in helping me to get where I am now, which is over 18 years in recovery. The pandemic has brought increased levels of isolation and disconnection, which is why it's more important than ever to bring people together virtually through Recovery Reinvented to focus on behavioral health. The Department of Commerce did a survey, And they learned that 68% of North Dakotans have experienced an increase in mental health struggles, including anxiety and depression, and that 1 in 5 people have reported an increase in substance abuse since the start of the coronavirus pandemic. Recovery Reinvented is dedicated to eliminating the stigma of the disease of addiction and mental illness, and provides solutions and resources for people and families who are struggling. And Recovery Reinvented is really all about hope. The governor and I are grateful and honored to be hosting our 4th Recovery Reinvented, again next Wednesday, October 28th. And we do this event in partnership with the most innovative behavioral health team in the nation, and we're so grateful for their partnership. We're going to be joined by some incredible people this year. You may have heard of this guy, Dr. Drew Pinsky. He is an addiction medicine specialist. He has a degree, a medical degree in addiction medicine. He's also been a director of a psychiatric facility. So he understands the intersection between mental illness and addiction, which is what he will talk about at Recovery Reinvented. We also have this guy named David Sheff, who wrote a book called A Beautiful Boy about 10 years ago, which became a movie called A Beautiful Boy about a couple years ago. And it's the story of his son's struggle, of his son Nick's struggle with his addiction. And it's a story about how that impacted their lives, the family's lives, and he will also talk about the intersection of mental illness and addiction. And other topics we're going to talk about are things like virtual recovery support services and how important those are now during this pandemic, and how easy it is to reach out for help through virtual and through technology. We're going to also focus on, again, the intersection of mental illness and addiction, especially as it relates to ACEs, which stands for Adverse Childhood Experiences. And then finally, we're going to talk about how important it is for businesses to build recovery support in their organizations, and how important that is for employees to have that support at organizations. We're going to focus on and feature and lift up a company called Solid Comfort based in Fargo, North Dakota, that has an incredible story of how they support people in recovery. 75% of their workforce are people that have been incarcerated or are in recovery. And they have a program they've started called Solid Start to get people back on their feet and help them as they go to work at Solid Comfort. So I'm super excited that we're going to have them join us as well to share their story. And in addition, we'll do what we have done every year. We're going to share the stories of people's addiction and recovery. We're going to talk about updates on resources and programs available across the nation and in the state of North Dakota. And we're going to recognize individuals and groups who are making a huge difference in this area of addiction and recovery. So this conference is free and open to the public, and it's free because of the incredible sponsorship that we have from so many great organizations. And now more than ever, that's important so more people can access this conference. But you have to go to recoveryreinvented.com and register to be able to access the conference. It'll be from 9 a.m. to 4 p.m., and you won't want to miss the start of this because Dr. Drew will be kicking off the conference for us. And I tell people to turn it on like Spotify and just let it run in the background. You can multitask, you can fold your laundry, make your lunch, do your puzzles, whatever. But it's going to have incredible information, and I hope everyone will join us. And just want to clarify, too, again, this is provided by sponsors, and there are no taxpayer dollars used for us to put on this conference. that's it on Recovery Reinvented. Now I want to talk about two other things that are super important. One is I want to share there are two resources really that are available for people in the state of North Dakota and elsewhere that are, that people might be needing more help related to behavioral health and issues. And one of them is Recovery Talk. And this is a phone line that is answered 24 hours a day, 7 days a week by peer support specialists. These are people with lived experience with the disease of addiction and mental illness. And people can call this number and talk about their struggles and, maybe get connected with someone that can help them moving forward. And the service is free, and it's confidential, and it's anonymous. And the number is 1-844-44-TALK-2. Again, that's 844-44-TALK-2. This information is available on the recoveryreinvented.com website if you didn't get the number, and it's also available through our behavioral health at nd.gov website. Then there's another resource available that I wanted to share with you called Project Renew. And this really came about as a result of the pandemic. And it's a partnership between the Behavioral Health Division and Lutheran Social Services that provides free and anonymous support services to individuals throughout the state. Including supporting community members in understanding physical and emotional reactions to COVID-19, developing and improving coping strategies, reviewing options, and connecting with other individuals and agencies that can be of assistance. The Project Renew hotline can be reached at 701-223-1510. That's 701-223-1510 from 8 to 5 every day, Monday through Friday. So that concludes what I came to talk about today. So please come and join us at recoveryreinvented.com and register. It's going to be an amazing day. Thank you.
Thank you, Catherine. Again, echoing that, we have, I think, over 1,500 people have already signed up. Over 1,800 people have already signed up. There is no limit. Reserve your space now. Go to recoveryreinvented.com. But whether you're a person in recovery, you have a family member who's struggling, but if you're a mayor, a city council person, if you're in health or public health, there are going to be so many resources here. And while this is going to be virtual, it is also live. I'll be in the studio with Catherine. Our national speakers will be coming in. She'll be interviewing Dr. Drew and others throughout the day. So I expect it to be very engaging. Live all day long. So again, tune in for some or all of it. It's free, but we look forward to seeing you there next Wednesday at recoveryreinvented.com. And with that, I want to close out here with a couple of quick notes before we go to our Q&A portion of it. And the first thing I want to talk about is on good news. A lot of people have stepped up in to help fight COVID, and we're grateful today for all the veterans, and particularly to the North Dakota Department of Veterans Affairs. They've recently released a series of posters based on vintage military posters, reminding us of the importance that each individual role plays, the individual responsibility that played such a big part, like during World War II, to how the nation came together to defeat a common enemy. Today, more than 55,000 veterans call North Dakota home, 23,000 of whom are over the age of 65 and are at a greater risk of COVID-19. And these brave men and women, they've earned our appreciation and our admiration through their service to the nation. They've given us much to make sure that we can live in peace and prosperity. So if you're looking for another why, another group to extend your support or your love to, that would be to our veterans. And so we have an opportunity to pay them back in a small way by coming together to protect our veterans and being all North Dakotans by following the protocols we need to slow the spread of COVID-19. But thank you to the North Dakota Department of Veterans Affairs and all our veterans for your contributions and for these beautiful contributions to our on these vintage war posters to help remind us what we need to do. In gratitude, I want to share my gratitude. We've singled out lots of different groups of healthcare workers, but of course, if any of you have had a loved one or a friend that has ended up being hospitalized with COVID, you know that this is a respiratory disease, and respiratory therapists who specialize in respiratory care are truly among those that are on the front line. Nationally, the week of October 25th to 31st is the National Respiratory Care Week. It's Respiratory Care Week here in North Dakota. I've signed a proclamation declaring such, and as we all, band together to fight this respiratory disease, we want to thank them, all these workers, for their work, whether it's in hospitals, in long-term care facilities, or in home health care. We're grateful for their care and their dedication because literally the work they're doing is saving lives when it matters the most. So again, thank you to all of our, and gratitude to all of our respiratory care workers. In closing out with a gratitude quote, I'm sure everyone knows the American author William Faulkner, who once compared gratitude to electricity. He said, gratitude is similar to electricity. It must be produced and discharged and used up in order to exist at all. So again, if you've got some gratitude for people in your life that are making a difference right now during these challenging times, take a moment and extend a thanks to them, and they'll feel better, and so will you. And so again, we can lead the nation in a lot of things, and we certainly can be in a state of gratitude and be another great place to lead the nation. So remember, we'll be back here next Thursday, October 29th at 3:30 p.m. And now we'll stand for questions. I want to remind people that we've also got we also have Chris Jones here to answer questions, and Superintendent Baszler, and of course the First Lady is also available for questions. I think we're going right back here, Matt.
Yeah, thank you for taking my question. For the past 7 months now, we've been talking about education. Apparently, it's not quite working across the state as numbers are skyrocketing. We're seeing bars in Fargo over capacity. Mayor Mahoney said the city's on the brink of shutting down. And we're seeing pictures from bars with people not wearing masks, promoting Halloween parties. We're doing a story today about 100 high school students holding a homecoming party at a hotel in Moorhead. Critics say this is due to a lack of leadership from the state to the local level. Nobody wants to be the bad guy. What's your response to those critics?
Well, I don't know that I guess I would challenge your premise, which is it's not about being a good guy or a bad guy. This is about individual behavior. I mean, if we, take a look at chronic health conditions in our nation, whether it's smoking, drinking, people being overweight, guess what? We've had doctors forever telling people that they should eat better, exercise more, stop smoking. There's all this talk about, hey, nobody's listening to the medical professionals. Well, we're a nation of people that don't listen to medical professionals. And so it's and I don't know why everybody's so surprised about that, because again, 1/4 of the $4 trillion that we spend on healthcare in the United States relates to chronic conditions that could be taken care of, not by bigger hospitals, not by new therapeutics, not by drugs, but by just more activity. More walking, more again, better eating, and more of the good stuff and less of the bad stuff. When it comes to smoking and other things that may be addictive. So it does come down to individual responsibility, and city leaders and county leaders and the state and the national level, internationally, create all the guidelines in the world. But this thing's going to come down to whether some person makes an individual decision when they get up in the morning. Are they going to choose to go to a place with crowds and low ventilation and nobody wearing masks because for them they think it doesn't matter, or are they going to choose to take care? And those will be individual decisions. And again, we believe in individual responsibility, and we believe that that as people gain more awareness about what the impacts of this are, people will make their choices.
But at some point, do leaders have to step in to protect the rest of the population who is adhering to the guidelines, to the recommendations, the education?
Well, I think, Matt, your question implies that when you say step in, that somehow that a mandate A would be enforceable and B, it would change behavior. And I think there's plenty of data that would show in states with mask mandates are also having record cases and record deaths. I mean, if someone can show me the correlation between the mandate and in the performance, that would be a good thing to see. We know that mask wearing works. We know that social distancing works. We know that washing hands work. We know all the things that work. There's, it seems to be an incessant debate about what's the best way to get people to do more compliance or more participation. And I happen to believe that it's going to happen when people decide that they want to do it because of either the community or the teammates or the classmates or the family members that they care about, that they love, then they're going to make the decision. But until then, somebody, government telling someone to do something, that may not make sense. Because again, I mean, we do a statewide mandate. I'm not sure, where that leads us. It might lead to less compliance versus more. I'll go Jack, and then Jacob, and then Jeremy.
For Chris Jones, please.
Thank you, Jack. Chris, thank you for being here.
Can you walk us through the changes from CMS for its indoor visitation at long-term care?
Yes, thank you. What I want to start up by is Adam Willis here? Well, anyway, I will tell you that Adam Willis wrote a nicely well-written factual article in the forum today regarding the changes to CMS, and I would encourage everyone to read that. But essentially, is what happened is CMS just released within the last few weeks visitation guidance when we have been dealing with this pandemic since March. There haven't been visitation guidance for skilled nursing facilities since they were closed in March. So the state of North Dakota, just want to bring this up, the state of North Dakota started visitation guidelines opening, phased reopening as we learned about the disease for skilled nursing facilities. We have been more open than any other. CMS just released their new guidance, and it's not really guidance, it's a federal rule that we must follow. So based on the positivity rate in many of our counties, as well as the fact that many of those long-term care facilities, those skilled nursing facilities, have positive residents and or workers in the last 14 days, CMS requires that they are only able to offer outdoor visitation, period. So we are, as a state, from a skilled nursing facility perspective, stepping backwards as it relates to visitation per the CMS rule. We will continue to negotiate with CMS because we know that outdoor visitation will not work in North Dakota. It doesn't work today, and it's certainly not going to work in January.
Forward then in winter, what would be the options and what kind of negotiations are you talking about?
We are now coming up with different ways that we can create sterile, safe, negative pressure rooms that potentially can be used within skilled nursing facilities. So it's about ventilation. But there is a way to open them up today. These could all be opened up today. I mean, I forget the reporter's name back there. But if people want skilled nursing facilities open, you got to drop the positivity rate. And that's up to communities. Many of our rural communities are having significant community spread. So if they want them back open, I mean, the power is in everybody's hand in North Dakota. If they would like to see long-term care open back up, with the current rules from CMS, start being smart. That's how you open them back up. We don't have to negotiate. We can do that ourselves.
One last question. The governor talked about rapid tests that might help in long-term care with facilitating visitation. What's the plan for those in the near term?
Well, per the CMS rule, we cannot use the Binox tests for visitation in skilled nursing facilities because visitation is closed. We will still suggest using them for skilled nursing facilities, and we will be using them for those other two areas, the other two service lines, which are basic care and assisted living, as an additional measure to help protect residents and staff in those long-term care facilities. But we will continue to test with the PCR test as well.
Chris, CMS has the new rules, but you said you're negotiating with them. Whose rules should facilities be following, and what's the kind of timeline we're looking at?
So again, I'm really proud of what Adam Willis wrote today, because it is accurate and factual. So I would just, if I say something wrong, I would just go back and read that. But the rules are in place today. So what happens is CMS, which is a federal agency, the federal agency sets the rules. The state is required to survey based on those rules. And if facilities don't follow those rules, those facilities fall out of compliance and can have financial penalties for not following them.
Maybe just jump on that one on the back end of that. We should just start, the purpose of that CMS is trying to do is trying to protect the most vulnerable. They came up with a national rule. There's very few states that have had visitation like we've had, but there are very few states that have been testing every healthcare worker in assisted living, in basic care, and in skilled nursing, and every resident every week since last spring. The basis for us to be able to open up visitation in long-term care, which we know helps the social connection, the emotional connection, all of that factors into the health of people that are in long-term care. Isolation is something that it can also be deadly. And so we were working very hard on that side of it, and the only thing that allowed us to do that and do it safely was because of the enormous testing resources we put together. For us to be able to do gold standard PCR tests on every resident, every worker in all three lines, assisted, basic, and skilled nursing, really no one else got that done. So the national rule comes along, it doesn't anticipate not only our geography and our weather, it doesn't anticipate the capability that we had already built up. So we will continue to work with CMS, but in the meantime, what Chris said, these are the rules that are in place right now. And what he also said was accurate, which is part of their rules are based on the amount of community spread. We've got community spread. So again, as I said earlier, find your why. You want to visit your loved ones, that'd be another reason for us to all help get the numbers to come down so that we would be, a visitation from the federal level would be allowed under their rules. Okay, I think I had I think it was Jeremy was next, and then I'm going over here to online, and then into the back row.
Governor, at the beginning of the month, you said it is an accurate statement that capacity today has not been a problem in the state of North Dakota, referring to hospital capacity. I'm wondering, do you think it's a problem now?
Well, I think it's tighter now than it was then, but again, in the conversations that we're having with the hospital leaders in the state, it's a balance. It's that we have to have. So it's again, instead of talking about how less than 10% of the beds are COVID, we should probably start every press conference and go, 90% of the beds in North Dakota are filled up with non-COVID related topics, because that could be the headline every day. Just keep running at 90% plus. It was as high as 95% non-COVID. 92% today non-COVID. So that's what's taking up a lot of the capacity. There was a lot of deferred healthcare last spring. We were one of the only states that allowed elective procedures to still be conducted. Some states still have limits on elective procedures. That frees up capacity. We've always allowed that because, as we hear, even though we allowed them last spring, we hear from leaders this week that if it was an elective procedure last spring, it might be an emergency procedure this fall. If someone's got progressive heart issue, a cancer issue, kidney issues that people were deferring on, create more serious need. So the balance is, how do we have enough hospital capacity for this 90% plus that we need for the non-COVID stuff, and then still have the capacity for COVID? So that's the problem we're working, and we're working through this backlog, if you will, of deferred health at the same time we're coming into this situation. But I remain confident that we're going to be able to figure out a way to manage the COVID cases and the 90% of non-COVID cases, and do that in a way where we can do that within the walls of the hospitals that exist in North Dakota. But to do that, it's going to require potentially even more collaboration than we have now. It may require more transfers, for example, because you may not have a small local hospital that's in a position to manage COVID, but they could be a step-down facility for a non-COVID case, which again is over 90% of our capacity. Would they be willing to receive and care for at the highest level non-COVID patients? Absolutely. Could they do that in lieu of us? Typically, they might have been sent back to a nursing home, but we don't want to. We want to, protect the nursing home. So we just have to find new ways of collaborating to find the most synergy among the capacity that we have right now. And as we announced in the $10 million grant earlier, we got to make sure that because it's not just about beds, it's about staffing. We have to make sure that we've got the right kind of staffing in the right places to be able to manage that. But like I said, and it's interesting in healthcare where some of the people that we're asking to collaborate are competitors, sometimes at a crosstown level, sometimes at a system level. But when we all get together in the room, I think right now there's an understanding that some of that competitive positioning has to dissipate, and we have to figure out a way to how to work together to create a North Dakota system as opposed to just a series of suboptimal competitive health systems if we're going to work our way through that. But I would also say, again, if you're worried about healthcare capacity, one way to take care of healthcare capacity is follow the North Dakota SMART guidelines, because the actions you take will help reduce the need for hospitalization. And there's one thing that we're hearing not only from the White House, but we're hearing from all the health professionals, which is get your flu shot. Getting your flu shot is one way to protect you from a non-COVID flu illness. That flu in the wintertime usually drives up hospitalizations. If we are not able to stop COVID, maybe because there's not a vaccine available yet, but we have an available flu shot, that could certainly not protect 100% of the people, but it's got an effectiveness that it would reduce the need for serious illness. So, getting your flu shot, and there are lots of ways to do that, either inexpensively or free. We'll continue to put out information on that, but all the other things that we talk about, whether it's practicing good hand hygiene, not going to work when you're sick, all of those little things reduce hospital capacity. So if you're worried about hospital capacity, again, your individual actions can help create that, because part of hospital capacity is, do we have enough staff? And if staff gets sick, and they're not getting sick when they're wearing PPP or PPE in the hospital facility, if staff members are getting sick, sometimes they're getting sick because they're out in the community, and so from the community is then knocking them out of the healthcare staffing capability. So again, when we reduce it in the community, we reduce the risk for healthcare workers, and we reduce we increase the supply of staff, we decrease the demand on the need for beds, and everybody wins in that scenario. So it's not trite to say we're all in it together. We actually are all in it together, and there's actually something that each of us can do. I'm going to go to, I covered you, right? Didn't we?
Well, I didn't ask you.
Okay, you got one there. I said I'm going online, and then in the back after that, we'll go online and then to the back.
April Baumgarten with the Forum. You talked about a Thanksgiving challenge, but should families consider not having or limiting family gatherings for the holidays?
Well, I think this is something we've heard on the White House calls from Dr. Birx, and we know that she's going to be in the state next week, and I'm sure we'll hear that again. In places where, and this goes back to the question about mandates, in a place where if you say, hey, by mandate we're closing bars, and then you stop having a bar gathering, and then it turns into a large party at a college or off-campus party or something like that, you haven't really solved the problem. So I think the language that we're hearing, which makes sense, is if you're saying avoiding crowds or avoiding large gatherings, then you need to also say that applies in any scenario. Just because you didn't go to a bar, but you go to a family gathering, and again, that family gathering could be a wedding, could be a funeral, could be whatever, but if you're with a couple hundred people who aren't masked, with the level of positivity rate we have, the possibility of someone in that crowd in North Dakota being infectious and not knowing it and be asymptomatic is actually quite high. And so, to April's question is, people need to be thoughtful about the size of all gatherings they're attending, whether they're family or whether they're in public, unless you're confident that everybody, quote, in your pod has been doing social distancing and you're really confident about that. But I'm sure a lot of people that have tested positive, that have come out of these positive clusters that we've observed through contact tracing from funerals or weddings, that people didn't go to those, and they probably said, hey, I didn't see any sick people, I felt fine. And then, wow, then all of a sudden we got, dozens of people sick, from those things. So yeah, it just makes sense. It doesn't matter whether it's a corporate gathering, a business gathering, or a family gathering. If you can't distance, wear a mask. If you're having a larger family gathering, again, figure out a way to do it in a larger space, or take the same rules. Same rules apply. Okay, yes, in the back.
Hi, Maddie Beer Temple, KX News. Earlier this week, there was a legislative committee meeting where one of the senators said he had a fever and he bypassed a temperature check so that he wouldn't get sent home. What is your reaction to that? And do you think that local leaders should be doing more to model safe behavior? Well,
I did have a chance to read that, and I felt like that we've said, I don't know if we've had 77 press conferences, we've said 77 times, that one of the considered things to do would be to stay home if you're not feeling well. That would include if you have a fever, particularly during this time. So I was surprised and shocked to see that quote in the paper. Okay, I'm going to go to Lane, and then we'll go back online.
Governor, you kind of mentioned it a little bit earlier about Fargo and Minot mandating masks. Is that kind of what you're wanting to see when you say that you want local leaders to step up and take charge?
Well, I think that each community's got to make their own decision about what's the best way to gain more support for less transmission. I mean, we're trying to manage transmissible moments, and tools are limited. Humans want to be around each other, but so if we've got people that are able to stay their distance, and if you can't, to have some kind of face covering, those two things help. So whatever mayors, city commissions can do in their communities that they think they're going to work, some communities it may work better than others, for different mechanisms, and so I think again local leaders are going to know best. And I really have enjoyed the mayor call, because mayors can identify things. I mean, we're down in some of these discussions, they're saying, hey, if we've got a dance studio, and the dance studio is following all of the proper things, and kids are being dropped off and they're all wearing masks and everybody's doing all the hand hygiene, they're cleaning between classes, but then if the parents that drop them off all stand together without masks right outside the door of the building, I mean, that's not something the state would ever see. That's something a mayor might understand. And then you might say, hey, let's take let's make sure we're protecting those kids that are going to dance class every week, make sure the adults are modeling the behavior too, or whether it's again a grocery store or some other store in a community that's got high volume that may not be taking appropriate controls. Those things are absolutely best handled at the local level, and even at the individual business level. Okay, I'm going to go back over here, ma'am.
Hi, Michelle Griffith, Fargo Forum. So you mentioned yourself that you've had about 77 press conferences, and most of them you've mentioned individual responsibility. So at what point do you say, and I mean, since then cases have been increasing and deaths have been increasing, so at what point do you say maybe it's time to rethink our stance here?
Well, I'm somebody who tries to lead with curiosity and always open to new learning, and I'd say we have learned a lot of things. We know a lot of things now that we didn't know then, back at the beginning of this thing, but I'm in no way ready to give up on North Dakotans. I believe in North Dakotans. I believe that people are moving in the right direction. I see more people that are following the guidelines as we go forward, and maybe that's because they have got more personal experience, maybe because they're learning more themselves, maybe because, whatever, maybe they've found their why. But I'm not ready to give up on that when I see the progress that we're going. And I take again back to positivity rate. When I see our rate, being a third of what some other states are, it's 1/4 of what, or less than 1/4 of what New York's was at the peak. I still have a lot of belief in North Dakotans that we're going to figure out a way to get through this with a, light touch of government and strong knowledge and understanding of how transmission works and how people can take steps to avoid that. Okay, I'm going to go back. I'm going to start this way and work my way right to left. So go online, and then is it Maddie? Okay.
Jean Shemp with Hometown Radio Group in Minot. Why did the Emergency Commission not reallocate funding to hire more contact tracers without traditional contact tracing conducted by state contact tracers? How will the state monitor where and how the virus is spreading? And will they ever go back, will contact tracers ever resume the task of notifying close contacts and tracking the virus through traditional means?
The answer for Jean is yes, and if I didn't say that clearly before, we are maintaining the capacity we have of all those contact tracers. They're going to continue to focus on working with local public health on healthcare workers, including healthcare, long-term healthcare settings, long-term care, K-12, universities will continue it there. We have added some much-needed automation this week to that process. That'll help free up a bunch of capacity. If we can notify people automatically of them being positive, that frees up more capacity immediately to do close contact tracing. And the commitment is to keep moving forward with that. And it wasn't a function of dollars per se, because there are dollars available in the health department and in the National Guard dollars for us to continue to scale the contact tracing. So yeah, we're committed to that. We know that the testing and contact tracing go hand in hand. But as I said, this is another area where if somebody does find out that you were tested positive, go to the website, watch the video, and do what I'm sure that everybody who's tested positive before, you told your friends, hey, I'm positive, and you should be aware of that. So I think, again, this step one of individual responsibility is notifying those people around if you test positive, because if you're asymptomatic, and we're catching a lot of asymptomatic people in our state, people may not have any clue that you're sick. You may not have known you were sick. So a good idea to notify people who you're around. Maddie?
As you say, mask mandates are inconclusive, but asking for personal responsibility hasn't correlated with any decrease in cases. What has worked, and do you think there is any policy that could help?
Well, I don't think we can say that individual responsibility hasn't worked when we've, throughout this pandemic for 7 months, have outperformed many other states whose economies were closed. I mean, our businesses are open, our schools are open, our universities are open, and we're still among the least in terms of positivity rates, and even in terms of fatality rates. Every death is too high, but we're still ranked among the lowest in fatalities. And so I think it has worked, but it's not a criticism of other states. Other states there was a Stanford study that was out earlier this year that there are places in the country where, if the majority of the people in a place approve of a mask mandate, then mask mandates have a better chance of working. If the majority of the people oppose mask mandates, then they might have the opposite effect. They may actually not work. And so I think tailoring the response at the local level makes a lot of sense, because even in our state, we've got different propensities for people to either want or want mask mandates or not want them, believe that they work, mask works or don't work. Those vary, particularly from east to west in our state. And so I think that's why, again, local decision making matters. But one thing we do know that works is testing. And we remain committed to our testing strategy, which is testing at the highest number per capita, even though North Dakota has had to take the I'm going to say take the brunt of being, in a national narrative. It's so easy for people to come back and say, oh, on test, cases per capita. I'll take you back to September. The first national story I saw was Grand Forks County being the highest per capita county in the nation. We had UND students coming back. We had 500 positives out of 10,000, a 5% rate, and there was one person hospitalized from COVID at All True in Grand Forks. There was 87% of the cases in that county were people between age 18 and 29, and there was only about 10 people in the whole county over age 65 that had it, and yet it was a national news story about leading the nation in positives. So this is where data can be utilized to push the narrative, and we're just trying to remain calm through all that. We've never backed off on our desire to look for where positives are, and we're going to continue to keep investing in strong testing strategies to help us identify. We know that works. Testing, contact tracing, social distancing works, and so we're going to keep doing those things. But again, we're doing it right now in the middle of a huge regional storm. I'm getting the signal that I've got one question left, and it's going to go right here.
Question for the First Lady.
Super, perfect, great way to end.
Hi. In the last month's first presidential debate, President Trump brought up Hunter Biden's cocaine use while he was in military and he was discharged. A couple of days later, Donald Trump Jr. went on the Glenn Beck program and called Hunter Biden crackhead Biden. First two-part question, have you contacted, and you've been working with the First Lady in the White House, have you contacted the First Lady and talked to her about the negative messaging from her family? And then also, how do you combat the counterproductive message with your own advocacy work on behalf of people coping and recovering from addiction that face shame and stigma?
Well, on the question of have I worked with Melania Trump, I have been invited to several events that she has been a part of, and so, from that perspective, I've had lunch with her, sat next to her, talked about lots of things related to the disease of addiction and, what her son has faced in schools and that sort of thing. And, I think in general, it's just not good to create more stigma related to the disease of addiction. And so, but on the other hand, I'm really grateful for the work of this administration and related to the money they put into combating the opioid crisis, the First Step Act, all the work they're doing related to, helping people with the disease of addiction is super important for our country, and I'm really grateful for that.
If I can, have you spoken out against? Were you aware of the comments made by the president and his son?
No, I wasn't aware of that. Yeah.
How do you feel about that?
I think I've answered the question.
Thanks, everybody. See you next Thursday at 3:30 p.m. Stay healthy.